Good afternoon, everyone. Good evening, everyone. Um, is my voice audible? Sorry for the delay. There was some technical glitch due to which my PowerPoint was not prepared. So that's why. We'll start quickly. Yeah. So, is my screen visible? Are you all able to see the first slide of my PowerPoint? Okay, great. So, we are in our week 5 discussion, and we have already discussed questions of 4 weeks, and today we will be discussing the previous year questions of week 5. I hope everyone has attended the lectures of week 5 and have come prepared to this session. Okay, so in today's session we have around 19 questions which we will be discussing one by one. You all know the rule now, that I will show you the question. You will have the options. I'll give you 1 to 2 minutes time. You all can think and answer in the chat box. Okay, and then we'll discuss the correct answer of the question. Okay, so I don't see any new names. I can see the old names. If is there someone new joined to the class, then I am Amrita, a PMRF student at University of Hyderabad. Okay, so we'll start now. Let's go to the first question. Milk from mothers of premature babies is rich in insulin, infection fighting proteins, oxytocin, sugar. Milk from mothers of premature babies is rich in insulin, infection fighting proteins, oxytocin, sugar. Your time starts now. Whoever has joined the class, everyone please try to answer in the chat box. Don't just sit down and see the question. Please try to participate actively in the session. This is an interactive session, not a one-sided session. So you all should be there. Okay? Okay, everyone is saying B. Infection fighting proteins, is it? Okay, we'll see that. Whoever is joining late, please start. This is the first question of the session. And yes, let me remind you again, please note down your marks. Like out of 19 questions which we'll be discussing today, how much marks you're getting out of 19. Okay. I hope everyone is enjoying the lectures by Rupal ma'am, and they are able to cope up with the classes and everything, and you all are doing your assignments well. I hope so. Like the current year assignments. I hope all of you are able to answer them correctly because of this practice session. Okay. Okay, is everyone done with the first question? Okay, let's see what is the correct answer. Correct answer is B. Infection fighting proteins. So, milk of mothers for premature babies who have delivered premature babies, like babies uh, before the delivery time, the milk of those mothers are rich in infection fighting proteins. Why they are rich in infection fighting proteins? So the function of breast milk is what? That it helps to protect your baby from infections, particularly of their gut. But the premature babies are more likely to have these infections, and that's why the mother of the premature babies naturally have those infection are rich in infection fighting proteins, so that the babies can be prevented from those infections. The milk of the mothers contain hormones, nutrients, and growth factors that will help your baby to grow and develop quickly, because of and as it is a premature baby, it needs to grow more than the baby which is delivered in a normal manner, right? Okay, we'll move on to the next question. Neonates necrotizing enterocolitis is a serious condition caused due to infection and damage to the dash. Neonates necrotizing enterocolitis is a serious condition caused due to infection and damage to the liver, intestine, kidney, or lungs. Start answering. Everyone should participate. I can see your answers in the chat box. I can definitely know who is answering and who is not answering. So, letting me point out who is not answering, I request you all, please be active throughout the session. Okay? Everyone is done? Okay. Let's see what is the correct answer to this question. Correct answer is intestine. So, neonates necrotizing enterocolitis. Entero word is there, means it is related to intestine. Okay. So, this is a serious condition caused due to the infection and damage to the intestine. So, here you can see the schematic representation of this condition. The gut is inflamed. The lining of the gut intestine has an inflammation which causes this neonates necrotizing enterocolitis. Okay. Okay, we'll move on to the next question. For premature babies, dash is very useful. Cradle hold, kangaroo mother care, football hold, sideline hold. Okay, for premature babies, dash is very useful. Cradle hold, kangaroo mother care, football hold, sideline hold. Start answering. Everyone is done? Okay, let's see what is the correct answer to this question. The answer is kangaroo mother care. I think everyone is answering correctly till now. Okay, so what are the benefits of kangaroo mother care? Okay, first of all, what is kangaroo mother care? So, kangaroo mother care is also known as skin to skin contact of the mother and the premature baby. And why it is beneficial for the baby? Because it regulates the baby's heartbeat, breathing, and body temperature as well. It helps the baby to spend more time in deep sleep when it is in skin to skin contact with its mother, right? And it also improves the baby's weight gain. As it is a premature baby, it needs to gain more weight to be living in the normal conditions, right? And the fourth point is it increases the mother's milk production for breastfeeding. As the mothers hold their baby close to the chest, it increases the mother's milk production for breastfeeding. It also increases the bonding between the baby and mother, obviously, or the baby and father if he is practicing the kangaroo care. If the bonding between the baby and the mother or the baby and the father increases if the father is also practicing this kangaroo care, right? Okay, we'll move on to the next question. The composition of mother milk changes every month or every single feed. The composition of the mother milk changes every month or every single feed. Start answering. Okay, is everyone done? This was a very simple question indeed. Okay, let's see what is the correct answer. The correct answer is B. The composition of the mother milk changes every single feed. Every time the mother feeds her baby, the composition of the mother milk changes. So now it is not like a great change, but a minute, but a little bit change in the thickness of the milk. That is, you may notice that the milk seems thicker and creamier towards the end of the feed. This is because as the feed progresses, the fat composition gradually increases due to the mechanics of milk moving through the breast. So, as the milk moves through the breast when the baby is sucking the nipple, the fat composition of the milk changes and it gets thicker and thicker as the feed time increases. It's often referred to as hind milk, while the first more is the watery milk known as the foremilk. Okay? Okay. We'll start with the next question. Breast crawl should not be performed for which of the following babies? Unstable babies with low birth weight, babies who cry well immediately after birth, babies born by natural delivery, babies born by cesarean delivery. Breast crawl should not be performed for which of the following babies? Unstable babies with low birth weight, babies who cry well immediately after birth, babies born by natural delivery, babies born by cesarean delivery. Start answering. Okay, let's see what is the correct answer. I hope everyone has given the answers. Okay, I think everyone has given the correct answer. It is unstable babies with low birth weight. So, first of all, what is a breast crawl? Breast crawl is the instinctive movement of a newborn mammal towards the nipple of its mother for the purpose of latching on to initiate breastfeeding. So, this breast crawl term is not just used for human beings but for all the mammals out there, and it is an instinctive movement of a newborn mammal towards the nipple of its mother to initiate the breastfeeding process. So in humans, if the newborn is laid on its mother's abdomen, it starts moving from at 12 to 44 minutes after birth towards the nipple to suck it for breastfeeding. But this is not advised for the unstable babies with low birth weight, the babies who have a low birth weight, or as well as the premature babies. So premature babies are also not allowed, are not given the state so that they can breast call towards the nipple because they are still having a very low birth weight and they are unstable, right? Okay, we'll move on to the next question. Which of the following options stimulates the baby to salivate? Which of the following options stimulates the baby to salivate? The smell of her hands, the smell of the mother, the smell of the outside atmosphere, the smell of the medicine. Your time starts now. Everyone think and answer correctly. Think properly and then answer. I'm giving enough time for each question so that all of you can think properly and answer, not in a hurry. Okay? Is everyone done? Should we proceed with the discussion of the correct answer? Okay, I'm assuming everyone has given the answers. Let's see what is the correct answer. So, the correct answer is A. I think some have given the wrong answer. Not a problem. But the correct answer is the smell of her hands. So, this is a very common wala thing. We must have all seen or observed babies at our homes. And what do they do always? They suck their hands and they keep salivating, they keep drooling, right? So that salivation comes from the smell of the baby's hands, which is why it starts sucking its thumb finger and it salivates, right? Okay, we'll move on to the next question. Das is the same for all mothers and babies. Okay, this is 1 minute. Please. Dash is the same for all mothers and babies. IMS or breast milk. Dash is the same for all mothers and babies. Is it IMS or breast milk? Oh no. Okay, whoever is saying A or IMS, I want to know what is IMS from you people. What is IMS? What is IMS? Okay, infant milk substitute. Correct answer. Okay, let's see what is the correct answer to this question. It is A. IMS. IMS is the same for all mothers and babies. So, what is IMS? It is an act to provide for the regulation of production, supply, and distribution of infant milk substitutes, feeding bottles, and infant foods with the view to the protection and promotion of breastfeeding and ensuring the proper use of infant foods and for matters connected therewith or incidental thereto. So, it is an act for providing the infant milk substitutes, the one we know like the formula food, and but the infant foods should be promoted with the view that breastfeeding is important, and the it should be directed properly about the proper use of the infant foods at what age of the baby and all the matters concerned with the infant foods. Okay. Okay, we'll move on to the next question. India passed the dash. It is also called IMS Act. So you all need to choose the option which has the correct definition of IMS and the correct year of IMS, everything. So go on, select the correct option. Everyone should answer. I can see all the names. Now I remember half of the names were joining regularly to the sessions as well. So I can know who is answering, who is not answering. So please be active in the class. It will only benefit you, right? Once you practice these questions, you will feel a lot more familiar with the present year questions as well, and also a kind of revision for the lectures, right? Done? Is everyone done with the answers? Okay, let's see what is the correct answer to this question. Yes, so the correct answer is A. We already discussed IMS's Infant Milk Substitutes, Feeding Bottles and Infant Foods Act 1992 and Amendment Act 2003. Okay? Okay. We'll move on to the next question. That was a quite direct question. So, ninth question is breastfeeding is a skill. It takes time and effort to learn or assist the proper breastfeeding technique. True or false? Start answering. I could see only three people have answered till now. What are the rest people doing? Are they still thinking? Start answering. All have answered. Okay. Okay, let's see what is the correct answer. Correct answer is true. We all know that breastfeeding is a skill, and it will, with time, the mothers will know how what is comfortable for the baby and which position is comfortable for the baby for the breastfeeding technique, what is everything. Okay. Okay, we'll move on to the next question. The IMS Act is considered violated if a food is promoted by any means specifically for children up to dash years of age. The IMS Act is considered violated if a food is promoted by any means specifically for children up to dash years of age. 3, 2, 1, or 4. Okay, let's see what is the correct answer. Correct answer is 2. So the IMS Act is taken to be violated if a formula food or processed food, the instant foods, are promoted by any means for specifically children up to 2 years of age, because up to 2 years of age breastfeeding is very important, so they should keep in mind while doing the promotion of formula foods that they should protect the importance of breastfeeding and as well, right? So otherwise it will be considered as violated. Okay. We'll move on to the next question. If during the surgery, doctor sense a medical emergency related to the mother, skin to skin contact in the operating room should be completed anyhow or may not be completed. If during the surgery, doctor sense a medical emergency related to the mother, skin to skin contact in the operating room should be completed anyhow or may not be completed. Start answering. Okay. Is everyone done? Okay. Let's see what is the correct answer. Correct answer is may not be completed. Right? During the surgery, doctor sends a medical emergency related to the mother. It is not compelled that the skin to skin contact of the baby and the mother has to be completed. As there is a medical emergency related to the mother, it can transmit to the child as well, right? So to prevent that, the skin to skin contact is not compulsory if a mother is having a medical emergency condition, and it may be uncomfortable for the mother as well who is sick, right? Okay, we'll move on to the next question. Early skin to skin contact in the operating room is important for the mother and the newborn. Early skin to skin contact in the operating room is important for the mother and the newborn. True or false? Everyone, please think, read the question properly, and then answer. Okay? Everyone has thought and answered properly? You think so? Okay, let's see what is the correct answer to this question. Correct answer is false, not true, right? What is given? Early skin to skin contact in the operating room is important for the mother and the newborn. Is it really important? The previous question we discussed, right? That if there is a medical emergency related to the mother, the skin to skin contact is not compulsory. The same goes if the mother has delivered the child by a cesarean method, then early skin to skin contact is not compulsory. Even if the mother has given birth to the newborn through labor, then also it is not compulsory. Why? We all know, right? When the mothers deliver the child, they are too much tired, too much exhausted to hold the baby. They are not in a condition to hold the baby as well. That's why early skin to skin contact is not compulsory. They can hold the baby after taking rest, and by the time the family members come and take care of the child, right? Okay, so it is not important to give skin to skin contact of the mother and the newborn just in like immediately after the birth of the child in the operating room itself. It is not compulsory at all. Okay. Okay. We'll move on to the next question. In the longitudinal position for skin to skin contact, the baby's chest, abdomen, and legs should rest on the mother's lower chest and upper abdomen, or upper chest and neck. So, where should the while as we are talking about skin to skin contact, what is the proper position of the baby which should be kept on the mother? The mother's lower chest and upper abdomen, or upper chest and neck? Start answering. Yeah, I am asking if you all are thinking it is important. Why is it important? If you are saying me that early skin to skin contact, please write down in the chat box if you don't agree. I can see that for the 12th question, someone has not agreed. But if you are saying it is important that skin to skin contact of the baby and the mother is very important, just at the operating room itself, is it important? Why so? Why will it be important? The skin to skin contact is nothing but kangaroo mother care, right? So that is for breastfeeding purpose or for the baby's regulation of heartbeat, temperature, all the benefits we discussed. So it can be given after the mother recovers from the pain of birth, right? It is not needed that immediately in the operating room, the early skin to skin contact. The question was early skin to skin contact, not just skin to skin contact. That's why it is false. Right? Skin to skin contact of the baby and the mother is required, but early skin to skin contact just after the newborn, it was written newborn, right? Just after the birth of the child in the operating room itself, it is not needed. So the answer is false. Okay? I hope you agree now. Whoever is disagreed, I hope they have agreed. Yes, yes, often mothers spend around 1 hour in the labor in the operating room. So after they have given birth to the child, are they given is the child given to the mother to hold it? No, because if someone is given delivery to the child through a cesarean or also a labor, they are unconscious for some time. So after some time, like after some hours, they are given the child to hold. They have a skin to skin contact, right? Not in the operating room itself. Breast crawl was, see, if the mother is in the condition to hold the baby, it is okay. But if she is not in the condition to hold the baby, it is not important, right? We are also emphasizing on breast crawl, golden first hour. Yes, the question was at operating operation room. That's why the answer is false. Okay, we'll see what is the correct answer of this question. Correct answer is A. So the position of the baby on the mother should be like the lower chest and the upper abdomen. Here you can see like the baby is placed lower to the uh, in the lower abdomen and the upper abdomen and the lower chest, right? Not here on the upper chest and neck part, obviously, right? Okay, we'll move on to the next question. Just a second. This Yeah. So the next question is, there are dash natural stages or behaviors of a baby after birth. There are dash natural stages or behaviors of a baby after birth. 9, 8, 7 or 5. Well, that is not a part of the question, that the mother is not in a position to hold the baby. See, the question has mentioned operating room. So operating room indicates that the mother just got operated, right? So we have to think accordingly. If they would not have mentioned operating, it is, see, two terms are mentioned in the question. One is early skin to skin contact, and second thing is operating room. So you have to think taking both the terms in context, right? Okay, give me a minute. My charge has finished. Okay, is everyone done with this answer? Is there still anyone who doesn't agree with that question we were discussing? Like, it's really nice that you all people are keeping your views. It is really necessary. And if I am still unable to convince you, I'll discuss it with ma'am, because this option of false was given by ma'am, and I also think that it should be false. Okay, Swati ma'am, if you're raising the hand, please write down your query, the chat box, if there is still any query related to this question. Okay, meanwhile, we'll discuss the uh, correct answer to this question. The correct answer is 9. There are 9 natural stages of behaviors of a baby after birth. What are they? Birth cry, relaxation, awakening, activity, rest, crawling, familiarization, suckling, and sleeping. Okay, so these are the 9 natural stages or behaviors of a baby after birth. Okay. We'll move on to the next question. Ensure dash of uninterrupted skin to skin contact in the immediate post delivery period. Ensure dash of uninterrupted skin to skin contact in the immediate post delivery period. 30 minutes, 10 minutes, 1 hour, or 20 minutes. I yet disagree. Okay, I have to discuss this with ma'am, and I have to ask her that maybe she can give a convincing explanation rather than me. And if I get a convincing explanation, I'll surely let you know. Okay? Okay, yeah. Please unmute and say yes. Yeah. Maybe you're correct. Like the question should have been a little more informative to make it a false statement, but due to that statement, it is confusing, right? That it should be true or not. So one can either think of the breast crawl, the golden hour, and the skin contact and make it true, but it should be false according to ma'am, right? Okay, uh, we should change this question a little bit. Okay, I'll inform this to ma'am so that she knows and thinks what is the better way to improve the question, so that you people don't get this question and get confused in the exam as well. Okay? Okay. Yeah, sure. Okay. Please answer the 15th question. Everyone is done answering? C. Okay. I'm still not seeing that everyone is answering in the class. I see only some people answering. Okay, let's see what is the correct answer to this question. Okay, C, 1 hour, right? Ensure 1 hour of uninterrupted skin to skin contact. Okay, so this answer is again complementary to the question we were still discussing. It should be true actually if we see. As it is written operating room, ma'am must have thought about the conditions of the mother and have given false. But yes, I now think it should be changed. Okay. Ensure 1 hour of uninterrupted skin to skin contact in the immediate post delivery period. Okay. We'll move on to the next question. Animal's milk has a high amount of a type of protein called dash, which is not easily digested by infants. Animal's milk has a high amount of a type of protein called dash, which is not easily digested by infants. So, which is the proteins that animals have and it is not easily digested by the infants, and that is why we don't have it. The mother's milk doesn't have it. Okay. Is everyone done? Let's see what is the correct answer to this question. The answer is casein. Yes. Animal's milk has a high amount of casein in it and it is not easily digested by the infants. Right? So casein forms a tough, hard to digest curd in the infant's stomach, whereas whey forms soft, flocculent, easy to digest curds. The amino acids taurine and cystine are present in high concentrations in breast milk than cow's milk, and that is why these amino acids may be essential for the premature infants, right? Rather than casein. Okay. We'll move on to the next question. A mother feeds an expensive formula milk to her baby, yet her baby is deficient in nutrients. Why? Formula feeds do not have antibodies, living cells, and good bacteria, thus resulting in poor absorption. Formula feeds are very high in enzymes which cause indigestion. The formula feed must have been expired. She must be overfeeding the baby. Read the question properly and answer. Okay? Okay, so I just messaged ma'am. That was a wrong answer. False. It should be true. Okay. So the question we were discussing about early skin to skin contact, it will be true. Okay. Okay, let's see what is the correct answer to this question. It is A. Formula feeds do not have antibodies, obviously, right? Why will they have antibodies, living cells, or good bacteria? As they don't have these things, this results in poor absorption, right? Yeah. So, a mother feeds an expensive formula milk to her baby, but her baby will still be deficient in the nutrients as the formula feeds do not have antibodies or living cells or good bacteria, which is also needed for the baby to absorb the food properly, right? Okay, we'll move on to the next question. A mother is doubtful about colostrum, which is the first milk produced by the breast after the baby is born. Which of these is not true regarding colostrum? Colostrum should be discarded and it shouldn't be given to the baby. Colostrum contains good fats. Colostrum is rich in vitamin A. Colostrum is creamy white or yellow in color. This is a very obvious question, and yes, everyone is giving the correct answer. Colostrum is really important. It is the first milk produced by the breast of the mother after the baby is born. So colostrum should not be discarded and it should be given to the baby. It's very important as it contains good fats. It is rich in vitamin A. It is rich in antibodies, IgG antibodies, which is present in the colostrum. Right? So it is very important. Okay? We move on to the last question of our session. A baby is not able to breast crawl effectively. This could be because he is incorrectly placed. In which of the following way should the baby be positioned? The baby's back should touch the mother's tummy. The baby's hands should touch the mother's tummy. The baby's tummy should touch the mother's tummy. Or the baby's sides should touch the mother's breasts. Okay, is everyone done answering? Okay, let's see the answer to this question. It is C. The baby's tummy should touch the mother's tummy. That is the correct position to for the baby to breast crawl, right? Okay, with this we are at the end of our today's discussion, and yes, that answer should be true, not false. Okay, so whoever is given true, they are correct. Okay, so let me know your marks out of 19. Whoever wants to share, they can share. Okay, congratulations, go green. 19 out of 19, a very nice score. Okay, Swati has also scored 19, really good. Nice, very nice. Okay. 17 out of 19 is also a good score as well, right? Okay, yeah, nice. Okay, if anyone has any doubts regarding the questions we discussed today, you can tell me here. You can write down in the chat box. If not, we can discuss. Does anyone have any doubts or any questions to ask? They can ask now. Time is there. Or shall we disperse? We'll meet again on next Tuesday with the sixth week questions. The answer is lower chest and upper abdomen. Okay, we discussed this, right? Yeah. Okay, okay, so we'll disperse. We'll meet again on next Tuesday. Everyone, please be on time. 6 to 6:15 is the joining time. Please, everyone join by 6:15 so that we can start early. Okay? Okay, please attend the lectures regularly and come to the session and participate actively. It will only help you in answering the questions and do well in the exam. Okay? Okay, we'll meet again next Tuesday, same time. Okay, thank you everyone. Thank you, thank you.